All right.
Recording again.
Thank you, Martha. So we have the pleasure of hearing from 4 speakers today. I'm going to give you a brief introduction of who will be presenting, and you'll get a chance to get to know them throughout the session. First, Dr. Caitlin Northey is an assistant professor of early childhood at the University of Vermont. Her research focuses on policy implementation and leadership in early childhood education, as well as issues related to the early childhood education workforce. She's currently interested in the work of state early childhood education leaders and the sustainability of improvement efforts as early childhood systems merge or negotiate oversight and resources with each other and the K-12 education systems. She's a past employee of NIEER and was a consultant for this project. Next, Kate Hodges is a policy research project coordinator at the National Institute for Early Childhood Education, where she primarily coordinates projects focused on state and national policy analysis. Her current work includes collecting, analyzing, and dismantling data for the State of Preschool Yearbook, coordinating activities and data collection for the Infant and Toddler Policy Research Center at NIEER, and supporting New Jersey PreK expansion and program implementation. Prior to joining NIEER, she taught in the classroom for over 5 years and worked in education administration for children from birth to 2nd grade. Next, Dr. Barbara J. Cooper was appointed as Secretary of the Alabama Department of Early Childhood Education by Governor Kay Ivey on July 1st, 2020. She has served the Department of Early Childhood Education since 2018, directing the nationally recognized high-quality Alabama first-class PreK program. She previously served as the department's director of the Office of School Readiness and is the birth to grade 12 advisor for the Alabama's Governor's Office for Education and Workforce Transformation. Dr. Cooper's administrative career is extensive, as she previously served as Deputy State Superintendent and Chief Academic Officer of the Alabama State Department of Education, Chief Administrative Officer of the Montgomery Public Schools Intervention, Deputy Superintendent of Huntsville City Schools, Chief Equity and Engagement Officer of Aurora Public Schools in Colorado, and a principal with Denver Public Schools. She has teaching experiences ranging from early childhood education through post-secondary. And last, but certainly not least, Dr. Monica Delamay is the Director of Early and Elementary Learning at the West Virginia Department of Education. She oversees all aspects of West Virginia's comprehensive approach to early and elementary learning systems for grades pre-K through 5, including areas of focus such as school readiness, West Virginia Universal Pre-K, the state's transformation system of support for early literacy, and all grades pre-K through 5 initiatives that promote an emphasis on content standards and supports. Additionally, Dr. Delamay served as the chair of the West Virginia Department of Education's Pre-K through grade 5 Executive Council, is one of 3 state executive members of the Early Childhood Advisory Council of West Virginia, and serves as a commissioner for Volunteer West Virginia. Dr. Delamay has more than 20 years of experience in the field of early and elementary education. She has served as an early and elementary learning assessment and school readiness coordinator, outreach professional development director, qualitative program evaluator, child care center director, preschool teacher, program director, curriculum educator, and adjunct faculty member at Marshall University. As you can tell, we have a very well-rounded and knowledgeable presenters. And with that, I'm going to turn it over to you, Kate. Thank you so much. We look forward to the presentation.
Thank you so much, Deborah. So welcome everyone, and thank you for joining us today. If you could, please put your name and your organization or affiliation in the chat as we get started, just so we can get a sense of who's here. And so today, during this session, we will describe the organizational capacities, enabling conditions, and core functions of effective state offices of early learning. We're going to share the 12 lessons learned from our case study of 4 states. And we're going to discuss strategies to increase the effectiveness and alignment of state agencies overseeing early childhood programs with insights from our esteemed panelists, Dr. Cooper and Dr. Delamay.
So first, why do this work?
State Offices of Early Learning, or SOELs, are responsible for setting policy, distributing billions of dollars of both federal and state funds, and ensuring accountability for those funds. Yet there's no empirical evidence on governance structure and its effectiveness. In this study, we really wanted to get under the hood of governance. To do this, we studied 4 states: Alabama, Michigan, New Jersey, and West Virginia. These states were selected based on indicators of effectiveness and quality early childhood programs. Each of these states met 8 or more of NIEER's quality standards benchmarks, at least 11 of 15 essential elements for high quality pre-K, and had research or program evaluation data on effectiveness of their state-funded pre-K program. To collect data, we visited each SOEL and conducted over 15 interviews in each state with agency leaders and staff, philanthropic partners, advocates, and other key stakeholders. We examined data and reports on the programs administered by the SOEL. These visits and interviews were conducted in late 2019, early 2020. So for most of us on the research team, this was our last plane trip before the pandemic. Each of the 4 states that we studied has a high quality pre-K program, but their SOELs varied on governance structure. On this slide, you'll see aspects of the SOELs that brought unique perspectives to our study. First, Alabama's Department of Early Childhood Education is a separate state agency apart from the Alabama State Department of Education and has a structure of state-employed regional directors and staff to help guide program quality at the local level. Michigan's Office of Great Start is housed within the Michigan Department of Education. The Office of Great Start has responsibility for all major early childhood programs, including state-funded pre-K, childcare, early childhood special education, early intervention, Head Start, and family engagement. New Jersey's Division of Early Childhood Education is one of 6 divisions within the New Jersey Department of Education and was established in response to the court-ordered Abbott preschool program. Finally, West Virginia's Early and Elementary Learning Services is housed within the West Virginia Department of Education and includes the entire pre-K through 5th grade continuum in the SOEL and offers universal access to preschool for all 4-year-olds in the state. So this is our overarching research question for the study. What are the structural characteristics, organizational capacities, and programmatic functions of effective SOELs?
Our theory of change for this study drew upon prior research conducted by NIEER and the Gates Foundation. The essential elements of effective pre-K programs highlighted the importance of having an enabling environment, including things like strong leadership, political support, public will, rigorous program policies, which reflect what we know about quality practices, right? So things like qualified teachers, competent leaders, small class sizes, et cetera, and coherent program practices such as curriculum, professional development, and regular use of child, classroom, and program data for continuous improvement. Together, these components lead to effective pre-K programs that produce lasting benefits for children. Our study was further informed by research on governance of early childhood systems, systems reform in education, and early childhood systems. We know that early childhood systems are complex and reflect the contextual histories of each state. Therefore, we examine the histories, structures, and goals and capacities for each of our 4 SOELs. Additionally, an SOEL's effectiveness is shaped by the support and engagement they have within their states. Therefore, we also explored the different aspects study participants felt further enabled their office to be successful. For example, when political and public will align with an SOEL's strategic goals, that produces a broad commitment to a shared vision that is more likely to come to fruition and support the function and effectiveness of the SOEL. We were interested in examining how these separate pieces interacted and influenced one another, as the enabling environment shapes how structural and organizational capacities are activated and used to carry out the work of the SOEL. And we characterized the work of the SOELs into 6 functions that are critical to achieving enhanced early learning outcomes.
So how do we define each of these 6 functions? First, promoting program quality. Developing and implementing policies, which may include program standards, regulations, guidance, licensing, and accountability systems like accreditation and state quality rating and improvement systems. Guiding instructional quality, building an integrated system of student learning standards, supporting or providing guidance for selecting a curriculum and aligned child assessments. Child assessments include preschool child assessments, a kindergarten entry assessment or KEA, and other formative measures that might be used. Supporting educator competence, ensuring a qualified teaching and leadership workforce in a supportive environment. This includes workforce standards, career pathways, core competencies, professional development resources, coaching models, a training registry, or any other wage supplements or policies regarding salary parity. Using research and data, employing a robust continuous improvement system, including collecting data and facilitating self-assessment at all levels, from children and families up to the state level. This function also includes contributing to an early childhood integrated data system, producing reports and communicating with the public and key stakeholders, analyzing data or contracting out for data analysis, and conducting program evaluations or longitudinal studies. Strengthening the continuum of learning, fostering a coherent system of care horizontally across settings and vertically across ages. This includes family engagement policies, aligned birth to third grade policy and practice at both the state and program level, and engaging stakeholders in transitions of children across the continuum of learning. And finally, efficiently managing public resources, affecting sound program and fiscal management of the SOEL, including finance and accounting for grants to districts, contracting with technical assistance providers or other intermediaries, internal human resources or professional development, internal and external communication and outreach.
So while we hope that you all read our research report, we would like to tell you a little bit more about our findings by describing 12 overarching lessons that we learned from our data. And just buckle up because we learned a lot. First, our findings don't suggest that structuring an SOEL as a separate agency is more advantageous or leads in and of itself to greater effectiveness. Instead, an elevated position in the hierarchy for early childhood seemed to be critical, especially with support from the governor, as this provided an SOEL with greater access to decision makers and visibility within the state. Second, focusing on supporting the whole child across all domains of learning, development, and well-being, as well as designing and supporting coherent practices across grade levels, it provided a common language as well as a shared understanding and goals for educators, parents, and community partners, and promoted a continuity in learning for all children. Third, all 4 states had a set of goals and priorities for their work that focused on quality. They were driven by strategic planning processes that inform their vision and engage staff and stakeholders in continually examining their goals and setting achievable targets. Fourth, while each SOEL had a different focus or emphasis on specific functions, all 6 functions were important and interdependent. SOELs can use these 6 functions in many ways, including highlighting the complex nature of their work, advocating for capacity and resources, or identifying specific aspects of their operations that they would like to be strengthened to achieve their programmatic goals. Fifth, these 4 states had cultures of using data to drive their decision-making, and they made data publicly available to support programs and to drive public and political will. In all states, data on the quality and impact of the PreK program, and in some states, other programs, led to increases in funding. Sixth, each SOEL worked to break down programmatic silos, create buy-in around a common set of goals, and ensure coherence across program and agency initiatives. 7, highly capable and effective SOEL leaders and staff shared a commitment and a passion for serving children, teachers, and districts in their state. Additionally, the SOELs valued cultivating leaders and long-term staff that had deep and broad expertise in early childhood education, institutional knowledge, and strong relationships. 8, we learned that adequate capacity was more than just a number of full-time staff members. An effective SOEL needs a sufficient quantity of highly capable staff. Our study found evidence that often SOELs were not able to accomplish all that they wanted to for children due to restricted staff capacity. 9, Our findings support previous research that infrastructure from the SOEL to the local level is critical to not only drive quality and accountability, but also to energize and unify the system to focus on achieving goals for children. 10. While it varied across states due to changes in governors and leadership, bipartisan political support for early childhood education was a key factor in the visibility of each SOEL. The leadership of senior staff and their position in the hierarchy contributed to their effectiveness in cultivating political will. And 11, collaboration both within the SOEL and with external stakeholders was a driver in meeting strategic goals and motivated stakeholders to keep grappling to find solutions when things were difficult. Our findings suggest that relationships were just as important as policies and priorities to support continuous improvement for all children, regardless of setting, auspice, and funding. And finally, SOELs cannot achieve their goals alone. Expanding and sustaining high-quality programs requires a diverse set of voices, especially those that might not typically have their voices heard. Advocates are one of the critical, but not the only, partners in garnering public support and funding.
Now that you've heard a little bit about the study, well, actually a lot about the study and our findings, we'd like to explore what these functions and lessons look in practice. First, I'm going to facilitate an interview-style conversation with Dr. Cooper and Dr. Delamay. Then we'll have some time for questions. So as you're reflecting on what you heard about the lessons or the functions or your own questions in your own state, we invite you to type any of these questions into the chat. Caitlin will be looking through it and monitoring as we have our conversation. And then right afterwards, we'll go into a question and answer with our experts. So Dr. Cooper, I'd love to start with you if that's all right.
Yes.
Wonderful. Could you give us a brief overview of the structure of the Department of Early Childhood Education?
Yes, thank you for this opportunity too, Kate, and thanks for the study that NIEER has conducted. I'm actually honored to share the work we are doing at the Alabama Department of Early Childhood Education to support our youngest learners, which is comprehensive work. Since July 2020, in my role as the secretary of the department, I've embraced this opportunity to work with our stakeholders to prioritize investing early, and the NIEER findings in this research clearly aligns with our focus here at the department. Just to answer your question around the overview of the structure of Alabama's State Office for Early Learning, as you've indicated in the study, we are a standalone agency separate from the Alabama Department of Education. Since 2000, early childhood education professionals, Business Council of Alabama, advocacy groups, gubernatorial support through 3 administrations, bipartisan legislative backing, and preschool educators across all 67 counties have actually worked to refine the Alabama first-class pre-K framework, which incorporates program guidelines, classroom guidelines, early learning standards, professional learning at all levels, parent engagement, job-embedded coaching that provides coaching for all of our teachers. And we currently receive funding through the Education Trust Fund to support the department. We've created a model for high quality early learning and are now extending that knowledge into other areas of the work, including the QRIS system for child care programs. When I was appointed by Governor Ivey, she charged me with leading the department to continue expanding the work alongside early childhood education employees who are well qualified and experienced leaders within the department. To continue our success, we recognize we must maintain our focus on fully functioning infrastructure and expanding this work to sustain the high quality voluntary pre-K program statewide. Naturally, our system is being challenged by the pandemic, but because the foundation is strong, we've been able to remain focused on our expansion efforts. The offices within the Department of Early Childhood Education include the First Class Pre-K program, which has been nationally recognized by NIEER for the standards for 15 consecutive years. We also have other programs, including the First Teacher Home Visiting Program, Infant and Early Childhood Mental Health Support, Early Childhood Development and Professional Support, the Preschool through 3rd Grade Integrated Approach, Children's Policy Council, and the Head Start Collaboration Office. So that's kind of an overview of our current standalone structure within Alabama.
Thank you, Dr. Cooper. Could you tell us a little bit more about the major functions of your department, including if there are any that are your priority?
Sure. In addition to the intentional work we do to function as an effective Department of Early Childhood, we've identified several key priorities to support us in going deeper in structural and organizational capacity to achieve enhanced early learning outcomes. We actually recently, at our requests, requested and conducted an external operational study and analysis of the Department of Early Childhood to support us in being more effective and strengthening our structural and environmental and organizational capacity. These findings are helping to inform our work moving forward, specifically around program quality, instructional quality, workforce development. Efforts are critical right now as we continue to work to expand our first-class pre-K program, recognizing that we need more educators now for this expansion effort. We're trying to be more data informed and ensuring that we're actually using the public resources that we receive as efficiently as possible through our expansion efforts and constantly studying those efforts. As part of my transition into the role of secretary, we actually convened a transition team through the Hunt Institute that allowed us to really take a look at what we were doing in the organization and make sure that the foundation we had at the department would continue to be intact under new leadership. This transition team was actually chaired by Governor Kay Ivey and Representative Terry Collins. The transition team identified 7 key priority areas and 28 action areas that also are informed through this information we received through this NIEER study. Over the next year, we will actually create a comprehensive strategic plan to lead the department into the future. Our strategic planning efforts will include an analysis of our current staffing. The department has actually grown by 40% in 3 years, but our staffing has remained pretty consistent actually. We will review our program and service delivery, our internal operations, and place a greater focus on culture and climate, which, as you can imagine, has really been impacted by the isolation and inability to meet in person and trying to conduct business as usual in the wake of a pandemic. We will remain focused, however, on our pre-K expansion efforts. Our goal is to reach 70% by 2026. We're committed to hearing from the field. We've been stretched and tried to really strengthen our outreach efforts. We're going out into our 67 counties, meeting with our mayors, really looking at our mixed delivery system and recognizing that as we continue to expand, we're also going to be even more highly impacted because those that we're expanding to have many challenges in the mixed delivery system. And we have a goal to visit all 67 of our counties. Because of this expansion, workforce development is a critical priority for our state. We have a new apprenticeship program that was just approved, which will allow us to really provide those opportunities for high school students through college to be able to participate in the early childhood pathway while learning those competencies on the job. We have CDA expansion efforts to really build the workforce auxiliary teachers that are going to be needed as we continue to expand our classrooms. And we're encouraging our lead teachers to go back through supports of the Teach Scholarship to actually continue to move through the pathway as well. So we're really looking at all of those competencies and looking at the pathways as a way to continue to grow the department. But I think most importantly, we're really trying to look at our data-informed and quality improvement efforts. We recently brought on a Harvard data fellow to really help us continue to lead the department about being more intentional around our data collection, data analysis, and really using the data to determine policy and practice in the classroom and for continuing to expand our programs.
Thank you. Wow, it really does, you kind of exemplify one of the lessons that we covered, that, you know, these functions really do work so close together. It's almost hard to kind of parse out one piece of work from another. Thank you very much for that. And if you can look back and reflect on this work, are there takeaways that you could share with the group? Anything that might be helpful for other SOELs who might be interested in using this lens to look at their own work?
The information presented by NIEER has been very timely for Alabama, as I've explained some of those things that we've done around the major functions of the department. It speaks to the areas that we are also focusing on and will be critical in continuing to inform the conversations. Many of the lessons that have been identified align with our efforts to become a better early childhood education agency. These takeaways are also very critical for our work as we work towards strengthening the entire birth through age 8 system for early learning and governance with Alabama. Although our primary premier program has been our first class pre-K program, the lessons that we've learned there have just been transformative for the entire birth through age 8 lens, and helping to really focus those efforts more, recognizing that learning doesn't start when children walk into a pre-K classrooms. There is so much that we must do before, and certainly to increase and improve the transition into kindergarten as part of that whole birth to age 8 continuum. A takeaway for us is that quality is a must in early learning, and there are no substitutes for quality programs and educators. To get the quality through performing the functions critical to achieved outcomes we desire, however, we must invest, and we must be committed to paying for what we believe matters and what is important. We must invest in the entire workforce, and those are the messages that we're giving as we meet locally, as we meet on the state level, and really try to best align all of our resources. This, of course, includes strategies that support coaching, instructional support. The pandemic has taught us trauma-informed practices and mental health support are critical from birth all the way through the workforce. And of course, pay parity. We have to pay our educators what they're worth because they are building brains, and that's the work we expect them to do. The funding must be there to support all of the things that matter as part of our work, and commitment to invest in the early learning ecosystem prenatally through the workforce have been key takeaways for us.
Fantastic, thank you. And you raised a lot of interesting points about the pandemic's effect on your work. And one thing to note, I mentioned it very kind of briefly at the beginning, is that the data for this report were collected all prior to the pandemic. Our last visit was in January 2020. So we are really, really hoping that we might have the opportunity to kind of dive deeper into this work and looking at the functions through the pandemic to see what might have changed in the offices and the divisions and the departments, and what was able to kind of remain the same. So thank you very much, Dr. Cooper. That was incredibly helpful. Look forward to hearing from you a little bit more in the Q&A. Dr. Delamay, may I ask some questions of you? Oh, there we go.
Absolutely.
There you are.
Hello.
Hello. So could you please give us a brief overview of the structure of early and elementary learning services and how it fits into the larger education system in the state?
Absolutely. Yes. In West Virginia, we have the West Virginia Department of Education, which is broken currently into 6 different divisions. And one of those divisions is teaching and learning. Within that, we have early and elementary learning services, which covers grades pre-K through 5. And then we have middle and secondary learning, grades 6 through 12. We have assessment, we have educator competence and development. But at any rate, Kate just dropped our website, which is a work in progress, I have to say, into the chat box just now. But really, we look at ultimately a pre-K through 5th grade approach, which is unique to a lot of states. Many states focus on that P3 approach. To give you a little context, full day, 5-day kindergarten was first mandated in West Virginia, I believe in 1996 or 97. So we've had that for a while. And then in 2002, the legislature decided that via bipartisan effort that universal pre-K would be available to all 4-year-olds and all 3-year-olds with disabilities by the conclusion of the 2012-13 school year. So 10 years were provided to develop a system that was not only of high quality, but also highly collaborative with community partners. State code requires that a minimum of 50% of our partners, or excuse me, of our classrooms must be in collaboration with either Head Start or childcare. And last year we were, we far exceeded that. We were at 82% collaborative. So 4 out of 5 of our classrooms are in operation with a Head Start or childcare program. It wasn't always easy. At first, there were challenges to helping make sure the quality was there, not only for the community programs or the Head Start programs, but for those public school-based programs as well. And forming relationships and change can be difficult at times. So we're thankful for the decade that we were provided by our legislature to develop those relationships. The unique thing about our universal pre-K program is that we have a state pre-K steering team that is mimicked at each of our 55 district levels as well. So at the state level, we have a state pre-K coordinator, we have a 619 coordinator, we have a DHHR representative, and then we have our Head Start state collaboration director, and they comprise the state pre-K steering team. With that in mind, each district has its own team comprised of their version of those same individuals. We have a strong commitment to quality. We laugh about how we meet 9 of 10, but it's really like 9.5 of 10 benchmarks, because with the professional learning, what we don't have in place is the requirement for all of our classrooms to have that evidence-based coaching model, though we are certainly pushing for that in all classrooms. And we know that it's already in place, at least in the 64% of our classrooms that are collaborative with Head Start, because they do have that, their research-based coaching models in place as well. So ultimately, we had, this 10-year time frame to build relationships. We worked closely with DHHR, we worked closely with Head Start, and then along came 2012, 13, and every county was to have a space for every 4-year-old. We laughed, if you were 4 and at the door, you had a space. So, and then of course, 3-year-olds with exceptionalities also have available a space. That was it was more troublesome for those counties that were growing in population. But in West Virginia, there weren't that many that were growing in population. Some of our eastern panhandle counties that are closer to the Washington, D.C. metro area were growing, but in many counties, they were losing population. So this was something that, allowed for space, to be located in whether it be in a childcare center or in a Head Start program or in a public school building. The space was found ultimately. And so, we also began our very humble roots as far as a structure of an Office of Early Learning. When I came to the Department of Education in 2010, there was no Office of Early Learning or even an Office of School Readiness. We were within the Office of Special Programs, which included special education and several other different programs, including universal pre-K. Shortly thereafter, an Office of School Readiness was developed. And then in 2012, our Office of Early Learning was developed. That at the time was designated to focus on pre-K through 5th grade. Simply because we made that split of middle and secondary learning so that, 6 through 12 and then P5. We work very closely with our early learning partners. We know that obviously, as Secretary Cooper mentioned, learning doesn't begin when they start in pre-K or kindergarten. It begins at birth, and And we know that it's very, very important to honor those partnerships as well. So we partner closely with our birth to 3 partners, DHHR, childcare, family childcare, in-home family visitation, and many others as well, particularly as part of our early childhood advisory council. So basically, we have a logic model that Kate just dropped into the chat. And our logic model has so many iterations. If you think about the functions of our state Office of Early and Elementary Learning, or Early and Elementary Learning Services, and the current iteration that you see is actually getting ready to be updated. It's dated September 2020. So some things have changed on it since then, but we keep our working copy, you know, in hard copy, and there are marks all over it and so on as we move forward. But ultimately, beginning in 2012, we wanted to capture how are we moving toward continuous quality improvement with all the grade levels with which we are responsible for providing educators and families and administrators resources to best benefit children. So it's looked very different over the years. The interesting thing that you may find about this particular logic model is that after the folks from NIEER visited with us in early 2020, we decided to realign and look a little deeper at our logic model and focus around those 6 functions of effective offices of early learning. So you'll see that the very first section, for example, I have it on my computer as well. We have some large areas, it's all color coded and stuff, but school readiness, standards and instruction for P5, 3rd grade literacy proficiency, early learning workforce, and then we have another area that are just you know, some of the things that our office also has absorbed over the years as far as tasks or projects. But we actually aligned those 6 functions to our work and looked a little deeper in like, you know, how do our school readiness outputs really promote program quality? You know, what does that mean? What does that look like? And it required us to look through a lens that we had not, we hadn't taken that deep of a dive before. And it was really cognitively taxing to do, to take our staff through this exercise. It was exhausting work because we knew that we have so much work going on from our very limited office, you know, as far as staffing, but we produce a lot of resources and materials and different items for educators and administrators who can use them as they need to benefit their program quality. So really, that's just how we function. Our logic model guides us. We also align to our state Board of Education and State Department of Education strategic plan. That's a very important document as well that we make sure we're always aligned to.
Wonderful. And I know you've touched a little bit on the major functions of the office, and you've pulled those functions directly into your logic model, which is publicly available and you know, shared widely. But is there anything else you wanted to add about any sort of major functions to your office
Sure.
or priorities?
Yeah, absolutely. So, you know, if you think about those functions, and we got to know those 6 functions very, very well, the deeper we looked at them, and my staff, they'd roll their eyes at me and say, oh, we're going to do this again. But it's not just an exercise in futility, because it really helps us determine where our resources are going and how our time is spent. Not everyone in our state needs the exact same resources. For example, we've really been charged lately, especially during the pandemic, with looking at low performing schools, which are called comprehensive school improvement schools, those lowest of the low performing. And then also those universal pre-K programs at the county level that aren't making continuous quality improvements over time are now part of our state's accountability system. So that's something, another aspect that we have to look at. So really promoting program quality is an overarching absolute that we definitely want to do. As Dr. Cooper said, there is no substitution for quality. There just simply isn't. And we don't ever want to forego quality for any reason at the expense of any other factor. So guiding instructional quality is also a major function of our office, and that really focuses on helping educators understand grade level content standards, understand classroom environments, understand pedagogy, those big rocks that are just really critical in the in the scheme of things when it comes to what does a quality classroom look like, and how can we help educators be successful. We could articulate that all 6 of the functions are just as important as the other, certainly. I mean, because they all have their own niche, but each of them are for a specific purpose. And as you see, if you take the time to look at our logic model, you'll see that we have, the short-term outcomes, the long-term outcomes, and then ultimately, we have like staff assigned to it and so on. The projects and initiatives sometimes, well, not sometimes, they often shift based on looking at what's going on as far as needs of the districts and needs of the schools. Our pandemic, again, as Secretary Cooper noted, the pandemic has brought to light so much trauma for children and the need for assistance with that early childhood trauma piece. And I mentioned in a previous session that I did West Virginia, even before the pandemic, led the nation in adult opioid deaths. Our state is being decimated by the opioid crisis. That was before the pandemic. So I can only imagine, unfortunately, now what so many of our children are going through on a daily basis with their families being impacted negatively by the opioid crisis. That's a whole other factor that we have to consider whenever we think about the whole child. So yes, I would say that the first 2 are incredibly important, but every one of those functions really makes a huge difference in the overall quality of what educational services a child receives.
Thank you so much. Before I ask you our 3rd question, I do want to remind everyone, if you have any thoughts or any questions or anything, to go ahead and stick them in the chat now. We'll be going, when we're finished with this portion, we'll be going to a question and answer, and we really would love to hear your thoughts or your questions or anything that might be on your mind. Excuse me, Dr. Delamay, pardon me. So now that you look back and reflect on this work, what sort of takeaways would you like to share with the group about looking at this work through the lens of the functions?
Sure. I would say stick to the plan. Political will is wonderful, especially if you're able to have bipartisan political will. We are very fortunate that we've had several governors have a commitment to early and elementary learning. Sticking to the plan and having champions at the state level. We've been very fortunate in West Virginia in that we've had many champions go to bat for early and elementary learning programming in our state. Began with some legislators who really felt that high quality universal pre-K was important. And now we even have a state superintendent who had his beginnings as a preschool educator. So many of you know Clayton Birch, and he was originally the pre-K coordinator at the Department of Education. He's now our state superintendent. So we've been very fortunate to have that leadership that has allowed us to continue to be fruitful in our services and our resources that we make available to those districts and educators who need our resources most. The other thing that we were able to do that has helped tremendously is that we have forged partnerships, one in particular with Marshall University in Huntington, about an hour west of Charleston, here our capital. But we have a technical assistance center there now, and we were able to fund some, actually 7 early and elementary learning specialists who serve as extensions of the West Virginia Department of Education. So even though they're not officially in early and elementary learning services, they know our philosophy. They talk our talk and they walk our walk, and they get out there when all of my staff is already out there working. We have 7 more people that have been just tremendously helpful to assist with building capacity, because yes, we're a small state, we're a rural state, but it takes a long time to travel from Charleston to the Eastern Panhandle, and it's a long way away. We're thankful for Teams, we're thankful for Zoom, but we know that there's nothing that really takes the place of that in-person rapport and relationship building that in-depth professional learning and coaching can provide. So that's another recommendation, is that if just leverage those partners who can help form relationships and stick to your plan. Make sure that the work you do is aligned to the overall strategic plan. That's been another key takeaway as well. And just celebrate those small milestones as you can. So thank you.
Absolutely. And it sounds like, one of the small benefits of the pandemic is our increased ability to use Teams and Zoom and these kind of technical platforms, so that we're able to be together even when we are across the state or even across the country like we are right now.
That's right. That's right.
Thank you so very much. Before I turn this over to Caitlin to do our Q&A, I did just want to quickly thank a number of people, especially the rest of our research team who weren't able to be with us today. Lori Connors-Tadros, Ellen Freedy, and Tracy Jose. We also want to thank our stakeholders, especially our stakeholders and state staff who worked so wonderfully with us and supported this work, especially Dr. Cooper and Dr. Delamay for their time and support, our generous funder, Heising Simons, our colleagues who provided valuable insight for the work, and especially to our wonderful host, Deborah, and the PDG B-5 TA Center for giving us this opportunity to come and speak with you today. We're really looking forward to our dialogue. So with that, I will turn off the share screen so that we can see each other a little bit better and pass it over to you, Caitlin.
Yeah, so we thought that this would be a great opportunity to have facilitated an opportunity for learning between you, our guests, and our panelists. So please put questions in the chat, but we're also a small enough group that if you would like to raise your hand, then we're happy to call on you and have you unmute and ask your question. So as people maybe type in the chat or think about what they want to ask, I'm really struck, Dr. Delamay, when you were talking about, sticking with your plan, aligning your work to your strategic plan. And I'm wondering, Dr. Cooper, if you have anything you would like to comment on, because this research was conducted between 2019 and just into 2020, and the pandemic has shifted some of, your office's priorities or functions potentially. And so how have you navigated your existing commitments to quality initiatives and responding to new needs and opportunities that have arisen due to the pandemic?
I fully concur with what Dr. Delamay has shared around sticking to your plan. It would have been so easy to go off course and start doing something differently because of the pandemic. But because the Alabama Department of Early Childhood Education actually had a strong plan and a strong foundation, we were able to continue moving things forward When we recognized that we were going to need to go virtual for a period of time, we were able to just build upon those structures that we already have in place around the coaching and the coaches being able to engage with teachers right away virtually to be able to continue to support the work. So fortunately, we had that type of foundation in place, but I couldn't look anyone in the eyes and say that the pandemic didn't change our world and change the way that we do things, but it allowed us to really get more creative and more intentional about the work as well. As a result of the pandemic, we now have very strong structures in place for our coaches. It allowed us to really take a look at our coaching model through a different lens and create something that is absolutely beneficial for our coaches that they took part in actually helping to create. We've looked at how we design the work out in the field in the 67 counties as a result of the conversations. And we purchased a curriculum that was Creative Cloud curriculum that, although we don't sanction what curriculum locals use, they're now all continuing to use that because they saw such benefit, and it was able to really help to engage families. So I think that although the pandemic changed the way we do some things, it also provided an opportunity for us to just really deep dive into the work and look at the quality. I mean, we're looking at data in ways now that's not just at the state level, but is this truly making a difference in every classroom? And, how are children experiencing what we're doing around what we offer for first class pre-K. And of course, now that we're over QRIS, it's also an opportunity for us to dig deeper and recognize that, again, this learning starts before children walk into a high quality pre-K environment.
Absolutely. Dr. Delame, is there anything else you'd like to add?
Well, I again echo Dr. Cooper's thoughts, and that you're right. It would have been it would have been not easy, but we could have all changed paths as the pandemic ensued. I mean, just not knowing what to expect. One of the things that we struggled with was looking at because we are such a rural state, the accessibility and the developmental appropriateness of online learning for young children. We really struggled with that. And so as a result, we took a hard stance that there would be no virtual learning for pre-K programs. Instead, we utilized what we called a distance family engagement model. And so basically because it's a voluntary program, obviously universal pre-K, we know that we had fewer children last year participate. However, during the times that our governor required remote learning for our K-12 children, those children who were in universal pre-K, the teachers actually worked to create novel family engagement opportunities that were free of cost for families, that were family friendly, that could be sent home, not in any way worksheet packets, because we don't do worksheets in pre-K certainly, but actual things to get children to ask questions and to look at the phenomena around their house or inside their home or outside their home, and learn about the world immediately around them, because they were so limited to being isolated to the world around them. So that distance family engagement model is one that we ended up being proud of, because it worked for us, and it was a solution that didn't result in children sitting in front of screens for long periods of time, because we know the detriments of that, certainly. Was it ideal? Of course not, but nothing's been ideal since the pandemic started. So
Correct.
So does anyone have specific questions that you would like to ask? Gonna give it a little bit of time because, you know, wait time, very important. We have a lot of shy people today. So,
Caitlin,
yeah.
Caitlin, one thing that I would add too, just as a key takeaway is this has really been an opportunity as well to learn from others. I'm looking at Monica because we've reached out to West Virginia. Every time we're together on one of these opportunities, I hear something else that they're doing that keeps us from having to reinvent it. This work is much too important for us to spend years trying to determine whether or not a strategy might be effective for our state. We're knowing that as we continue to expand our program, we're at a place where we're trying to be even more creative about how we do that outreach. And West Virginia has done a great job with their Head Start model. And they have a state superintendent that absolutely gets the importance of investing early. And so we're learning some lessons from others. And even this NIEER report is really timely for us because we're in the middle of creating a strategic plan. So really being able to build upon some of these states that are doing some outstanding work. West Virginia, I know New Mexico, we've reached out to them. Michigan, we have a meeting with Illinois next week. So just building upon what others are doing to support the work has been critical. I think our networks have been expanded because of the virtual, and maybe Zoom has helped a little bit after all, because we can connect a little quicker than perhaps when we were doing more in-person visits with other states.
That's a really good point, Barbara. I every time I hear you, I learn something new about the great programming that you have in your state, and it just makes me want to go to your website and check it out and learn more, because you're right. I mean, why do we need to recreate the wheel if there are already constructs in place in many states that we can glean from and make as we need to make it our own for our own purpose. Another thing that just came to me is really advocacy and really looking at articulating and marketing what we do. That is something as far, I know that the third question was, you know, what takeaways would you share with the group? Generally speaking, we're also busy doing our day jobs that it's difficult to think about, oh, wow, I wonder if the legislature is aware of this. I wonder if the Senate Ed president or chair really knows about that. Thankfully, I have the opportunity once a year to go over to a joint committee of the legislature and present our findings from really our office. It's based on some early literacy state code, but we're really able to weave in the whole comprehensive approach in our pre-K program. Some of the research that NIEER has done, not only with this particular study, but also with another study that they have done, and then are actually conducting a second study here in West Virginia to look at some long-term impacts of achievement with children. So anytime you get the opportunity to advocate and articulate and to market, just to let folks know all the great things that are going on, we have found that social media has been a great place to just share out. You know, for example, West Virginia became one of the, I think maybe the 10th or 11th state in the nation to be statewide with the Dolly Parton Imagination Library program in July. You know, so that was a big media push. We continue to do Imagination Library Thursdays on our social media. So every Thursday there's something on the department's social media about Imagination Library, even though they are covering everything really P12 and even with some adult ed programs from the Department of Education. You know, we know that we take every opportunity we can to just showcase some of the good news, because there's some really great things happening despite all the stress that our children and our teachers are experiencing, there's still some just great stories and great things that are happening. So that would be another takeaway.
Thank you so much. We do have one question. We have two questions in the chat, but the first thing I'm going to ask is, comes from Chris Jackson from Hawaii. And he says, wondering what the nature of the partnership with Head Start and childcare is in West Virginia. What motivated the state's legislatures to mandate prioritize this kind of collaboration?
Sure. Hi, Chris. I'm happy to answer that question. So as I mentioned briefly at the beginning, when I was talking, the state code that was written in 2002 requires that a minimum of 50% of our West Virginia Universal Pre-K programs at the local level are in collaboration with a Head Start or child care program. So when that legislation was passed, at the time, there was and there still is, a pretty robust Child Care Centers United organization, a Head Start Association, who, they advocate on behalf of their programs. And, one of the first things that we knew we needed to do to think about quality was to look at making sure that there were no inconsistencies or that regulations were not contradictory to each other. So when the state board policy was created, we included all the stakeholders from Head Start, from childcare, many stakeholders, and the state board policy that really looks at what all the facets of our universal pre-K program include. We didn't want to leave anybody out. We didn't want to leave any requirements out, not to not to overcompensate or make operation of a program so difficult that it wasn't worth anybody's time to do, but to make sure that it was of the highest quality possible and also still in compliance with the Head Start regulations, the child care licensing regulations if need be. Ultimately, the goal in our school readiness framework is to honor the fact, of course, that the child, the parent or the family, we have many grand families raising and others raising children. The family is the child's first teacher. And this is the family's choice as to whether or not they want to come to universal pre-K, but we want to be able to provide them with options. Maybe they need wraparound services, so therefore they likely need childcare. Maybe they need those family support services afforded by Head Start. The collaborations are so unique in West Virginia. There are really very few classrooms that are alike in collaboration. Every classroom has its own contract and budget, and based on whatever services or resources or professional learning or staffing are available and provided by each of those partners. So it's a really complex nature of the various collaborations. And I would love to have a more in-depth conversation with you about that. But we really do consider those collaborative efforts part of our success, because we couldn't have done what we've done so far in being able to serve all the children in our state whose families want to send them to universal pre-K and maintain the quality that we've been able to maintain and continue to move forward with higher quality as we go without our partners.
Thank you so much.
You're welcome.
Deborah is asking, how do you leverage social media to keep people informed? So Dr. Delmay, you would start to answer some of that already.
Absolutely. Sure. So, it's interesting with the Department of Education, as I mentioned, we are within the Office of Teaching and Learning, and there are different areas of service within that. Years ago, I would say probably 8 years ago, we started out with early and elementary learning. We had our own Facebook page, we had our own Twitter handle, we had our own, different social media accounts. And then the Department of Education, the leadership collectively said, enough is enough. We want to have consistent branding because of the fact that there are multiple offices that focus on multiple areas, and early and elementary learning is just one of them. So we share under the umbrella of West Virginia Department of Education. We now have one message, and it's we have actually an amazing communications team. We have a person dedicated solely to social media, and we put in a quick request, and it goes out. Like, we can indicate when we want it to go out, if we need to hold till tomorrow or until Monday or whatever. And then we indicate where all we would like it to be housed. We show things like timely research that educators might be interested in, like the study. We definitely link the study more than once. That is the focus of this session, and how West Virginia was one of the highlighted states. And here's the executive summary to read more. And also, like I mentioned, with Imagination Library, just any good news. And also, as counties share good news or bright spots with us, we know that we have a process in place, obviously, to make sure that permission is granted by the family. But there are opportunities where we're able to share out those bright spots as well, and that good news reaches far and wide, definitely. So yeah, anything that we can, we can really be as creative as we have time to do so in sharing out the information with our social media.
Dr. Cooper, is there anything you would like to share about leveraging social media to keep people informed?
Well, actually, we are in a place where we are needing to really expand those efforts around social media. We have a government relations person that's currently serving in that role, but we recognize that because so many relied so heavily on social media throughout the pandemic, that it's important that we really continue to grow in this area and really start to use that as a mechanism, a more intentional mechanism, because we have a lot of informal ways that that's done. I mean, through Twitter, through our website, and through other informal groups that are on social media, Instagram, just lots of different ways that we're able to get those quick messages out. But we definitely need to become more intentional. One of the things, though, that Monica made me think about is we're also doing Destination Library. We'll be starting that, and that's probably as a result of a conversation I had or heard Monica talk about. But the pandemic has really helped us with our children policy councils. Fortunately, that office is actually housed within the Department of Early Childhood. So we've pretty much reinvented how we're using all 67 of those children policy councils to really focus the work around investing early. Our manager for children policy councils has an opportunity to meet with all 67 of them quite frequently now that they have Zoom. But one of the efforts that we've been able to leverage is our campaign for grade level reading. So now we have a new focus around early literacy. 5 counties piloted being campaign for grade level readings, and they're doing all kinds of creative stuff, refurbishing boxes and bookmobiles and all kinds of ways to engage families of young children. We also expanded Reach Out and Read to all 5 of those counties. So the pandemic has helped us to really talk a lot more about how we can build upon some of these underutilized resources that we already had within the department. One of them being the children policy councils. Those are very active and engaged individuals in all 60 counties, and why not 67 counties, and why not build upon that expertise that meet frequently already to leverage things like pre-K outreach and early literacy and some of these other efforts that we have.
What advice do you both have for individuals who are trying to improve alignment with other early childhood services within their state? What strategies have you found that really work? Because you both highlighted the incredible collaborations you do, birth until preschool, across, opportunities for 3, 4, and 5-year-olds, and then into elementary school.
I think you have to, again, just become intentional about looking for those opportunities and not pushing them away. I had a recent example when we were doing Reach Out and Read. Medicaid wanted to partner with us, and Department of Health and Department of Mental Health. And we had a person in our office that said, well, we can fund it ourselves. But as I shared with her, this is an opportunity to build a partnership that will go much further than if we just fund it ourselves and not utilize that opportunity. And now, of course, as a result of doing that, and our governor got behind it because of her Strong Start, Strong Finish initiative, we have 3 partners that want to continue this initiative, whereas if we had done it on our own, it would just live right here within the department. But I think over this past year and a half, we've just saw so many perfect opportunities to just really leverage some of these partnerships. And fortunately, we did a transition report and transition committee that also put that down as number 1, collaboration and coordination among all of these early childhood agencies and stakeholders. So we're not duplicating the efforts and, repeating some of the same challenges that we've had for years. So I just think it's been a natural opportunity for us to engage around some of these things. In Alabama, with us having the QRIS project now implemented here at the department, we're able to really push this information down into childcare, and we're actually moving forward with a childcare locator that will be used by the entire state. So some of the data systems and opportunities to build upon one another's programs and use our funding, blend and braid our funding, has just been an opportunity to try to strengthen that. We're far from perfect, but at least we're having those conversations and trying to better align the efforts and be more intentional about who needs to be at the table has been a result of this work.
Yeah, we're far from perfect as well, and we realize that our work will never be done. This is continuous quality improvement is really what it's all about. Whether we're looking at universal pre-K, whether we're looking at the transition from birth to 3 into pre-K, or whether we're looking at 4th or 5th grade, it's about that process, that cycle of continuous improvement, regardless of where you are as an educator, as an administrator, as an advocate, as a family member. We want to permeate that message that we are all lifelong learners. And I tell everybody there's a whole lot that I don't know about a whole lot of things. And I hope to learn a whole lot as I continue on in my journey in this role that I'm so fortunate to be able to fill at this point in time. But others like Dr. Cooper and many of you on this call, you have amazing programs that we could learn a lot from. I know that. And it just so happened that NIEER decided to focus on 4 states who met their the criteria that deemed them as effective, but effective offices of early learning. But I would venture to say that there are so many amazing stories out there among all of you all as participants that I could learn from, Dr. Cooper could learn from, because I want to be that lifelong learner, and I want to make sure that my staff understands that as well. And I want to model that. It's really a service mentality when you think about it. We are in the work of service is how I see things, and helping just make sure that children have the best available opportunities as possible to be successful. And they need that assistance and high quality programming early on throughout their schooling. But we know if we don't get it right early on, the likelihood that it'll ever become in line or on par with grade level academically or socially or emotionally, behaviorally, or even physically, it diminishes with each year. So we have a window, and And I'm very blessed to be the person to help lead some of that work in our state. Certainly not the only one, though. Have a great team and a lot of great partners.
Well, thank you both so much. And thank you for everyone that is here. I'm going to pass it to Deborah just to have our final words.
All right, thank you. Thank you all for a fantastic presentation. And now the thanks are coming in on the chat. One of the things yesterday, Rebecca Gomez, Dr. Gomez, who was a consultant on this project, she and Dr. Lynn Kagan were just talking about governance frameworks. And a word that she used that I thought was very relevant, we talk sometimes about sustainability and how do you keep things in place. She used the word durable as well. And I think that that was just a great frame of thinking about what's happened in West Virginia and Alabama have created structures that have some durability because of the way that your structures have been created. But then I think the second thing is it's a continuous learning process. And so we're always learning, and we appreciate this presentation that helps us stay grounded and think about where we're headed for the future. So before we go, I just have a couple of quick housekeeping items again. I think we'll give you all a few minutes back in your day so you can rest between this time and the next session. We have a couple places we wanted to be sure that you're thinking about as you want more information on some of the topics that were covered during the convening overall. If you'll notice, this is the slide to the PDG B-5 TA Center. And on the top row to the right is the section on establishing governance and sustainable partnerships. There's a growing number of resources that are continuing to be added to that. So we encourage you to check that out. And I am going to paste a link to both this one and the next slide in the chat. And on our next slide, you'll see a resource to Early Care and Education Research Connections. This is also a great resource, online library of policy relevant research. So it goes hand in hand with practice. So please check that out when you get a moment. Thank you, participants. Thank you to our presenters. Thanks for your attention today, and we hope you enjoy the rest of the convening. Have a great day, and don't forget to catch the plenary that'll be in about 35 minutes from now. Everybody have a great day. Thank you.
Thank you. Bye.